When I first came to this hospital, I was asked to provide group therapy daily to the residents in our substance abuse program. Knowing that I wanted it to be research supported, I looked to the literature and the protocols to try and find something for a cognitive behavioral therapy for open groups. Unfortunately, I couldn't find any that were for veterans. They were all for closed groups, which lend themselves to research settings, but not a real life setting like at this hospital and many of the hospitals throughout this country. As such, with the help of others, I developed a 20-session group cognitive behavioral therapy protocol called Mind Freedom.
So as a social worker working with the veterans, I have seen improvement with the Mind Freedom CBT, and it seems to lend itself to our open group format.
CBT was the first tools that actually gave me confidence and gave me the ability to not only actually contemplate being sober, but that I would have the ability to be sober.
Many of the veterans reported to us that they found the Mind Freedom group therapy to be helpful in allowing them to transcend some of their obstacles after discharge and maintain their recovery.
When I went back to work, for an example, I had situations to where I would usually handle it incorrectly. But being that I'm thinking on my thought patterns and I'm seeing what's motivating my actions, I can stop them before they become negative.
That information, in addition to information that we pulled from our Mind Freedom Individual Therapy pilot project, which compared folks in Mind Freedom Individual Therapy to treatment as usual, suggests that the Mind Freedom concept may be effective. For instance, 100% in the Mind Freedom group completed their outpatient substance abuse treatment, compared to only 50% in treatment as usual. 84.6% of the Mind Freedom group were no longer using substances in the last week of their treatment. That's in comparison to 40.9% in the treatment as usual. Also, none of the folks in the Mind Freedom Individual Therapy group were transitioned to a higher level of care after their substance abuse treatment, versus 22.7% of the treatment as usual group did require that transition. Now that has access and financial ramifications. For instance, one estimate was that if extrapolated throughout the year, Mind Freedom could save this hospital about $500,000 alone. With the help of others, and through the finances provided in this grant, we created a patient manual and a facilitator's guide so that other VAs can provide the same type of Mind Freedom cognitive behavioral therapy to the veterans that they serve. We've found it to be helpful and hope that they do too.